Today, we shall study the introduction of the anatomy. First, I will introduce this very famous oil painting. This painting by Rembrandt. Now this painting is preserved in the Dutch Museum. This picture, the title is The Anatomy Lesson of the Dr. Tolp. Tolp is a very famous surgeon or anatomist in Holland. The Dr. Tolp, firstly, he found a structure between the small intestine and large intestine. Here, inside of this piece, there is a valve, two valves. This valve, then so the name we named the valve of Tolpis, or the ileocecal valve, another name. So if in memory of his foundation, so we call the valve of Tolpis. Then, firstly, allow me to introduce myself. My name is Shihai Ding. The surname is Ding. The surname is very simple in Chinese. Chinese culture, only two strokes, just like the English capital letter J. I'm graduate in the Shandong University. At that time, the Shandong University, located in Qingdao, not in Jinan, capital Shandong. Then, my specialty is human anatomy. Until now, I teach about 57 years. Now, I'm old. I'm 80 years of age. Then, some points of attention. First, the textbook. We use the textbook, this book. If somebody hasn't now, I suggest you to buy it. You can buy it from the Mr. Ni. Do you know? Yeah, Ni Lao. That's right. You can buy it here because this is our textbook. This textbook, I'm the reviser of this book. This book, you can see it. It's a planning textbook of Ministry of Health. So it is a unified to use in all over China. The reference book, you can maybe a lot of reference book, but here I just suggest you two. One is the Atlas of Human Anatomy by Netter. Netter is a very famous anatomist and a surgeon. He just not recently he was died. Yeah, maybe the atlas like this. This I maybe has a simple publication for students. Then another is the Greek anatomy. Greek anatomy is a very old book since 19th century, maybe over 100 years. Maybe somebody has the simple publication for students. Here. Then about teaching. The teaching, the total teaching hours 108. You can look here. Here is the schedule. So every time we're teaching according to the schedule. The method is maybe every every time 3 periods, about 3 hours, 2/3 lecture and 1/3 is experiment. Here has the schedule. The schedule just like you can watch this. So this is the posterior half. Then about some lab regulation. You know, we have some regulation of the laboratory. Starting the lesson, I ask you, every student must be present in the lab. Then everyone should take white dress cover, white overcoat. Maybe the scheduling system. If you haven't, then doesn't matter. But if you starting from the archaeology, then you must take the white overcoat. Does everyone have this? No? Oh, then it's better you also buy to 倪老师 because the white overcoat you will always use in every course, especially in the clinical courses. You must take the now in our lab when we study the soft tissue, the soft such like liver, etc., not bones. Then because it has the wet, so you better to take the white overcoat. Then all of the specimen or models ask you do not take out of the lab. If somebody absence are over 1/5, 20%, then this student cannot take part in the final examination. In other words, I will ask you, all of the record of this course, about 70% from the final examination, 20% from the mid-examination, and 10% for the homework and attendance and the present. So I ask you, it's better according to these rules. Then about studying, firstly, it's better prepare your textbook, then review the textbook and my slides. You can free to copy it every time you can free. Then I suggest you to do some every time the homework. I ask you to do it today. Then because our course is morphology, so we must, as much as possible, to watch the specimen. All of those specimen, we can watch it. Maybe just a little. We haven't because it's too tiny, too little. So we use the models. Then, in my slides or in my lecture, if there's a red star, then this belongs to the focus point. It's very important. You should remember in your mind. Another, because the anatomy is the foundation of clinical course. So we will introduce the clinical knowledge of the anatomy as much as possible. In my slides, I'm using the pink color. Now we shall study the introduction. Then the first is what is the anatomy? What is human anatomy? And the purpose of study. The human anatomy is a very important basic course in medical college. You know, the basic course, of course, is very important to the clinic, especially the surgeon or gynecology. That means the course has the operation. If you take operation, you must know the anatomy. Even the preclinical also is important. Such like now we study the human anatomy in gross anatomy, just by our naked eye, not by microscope. If by microscope, then you will study next term, histology. So then, at the base of the morphology, you will study the function. The function of our body, you will study the physiology. Afterwards, the tissue or the organ suffer from disease. What is the character of the disease? Then you will study the pathology. A series of courses you will study. So most of the courses you must have a good foundation of the anatomy. Then the anatomy can classify into two kinds. One is the systematic anatomy. Now we study that. So this book, although the title is Human Anatomy, but this book just belongs to the systematic anatomy, not including the regional anatomy. The systematic just composed in different systems, such like a skeleton system. All of the bones are into together, and each between the two bones has a joint. Then we will study arterial system. Then we can divide into digestive system. Look here. Then nervous system. Here is the endocrine system. Here is the cardiovascular system, and a different system. The total may be divided into 10 or into 20, into 12. Because the skeleton, joints, and muscle can be combined together into oculomotor system. Then another is the regional anatomy, or we call topographic anatomy. This anatomy composed of different regions, such as head, neck, thorax, abdomen, etc. Upper limb and lower limb. I saw you have your textbook, the red color. Maybe this book belongs to the regional anatomy. Yeah, this one. I know these three books. The writer is Indian. Is a very famous Indian. So this is the regional anatomy. Now, the general structure of the body is very if it has a shape, then the basic unit is cells. Then a lot of cells combine together into tissue. Then a different tissue combine into organs. Then all of the organs combine to the system. Then all systems combine to the organism. Just like here. Before cell, of course, you can divided into the very basic is atom, then molecule, then micromolecule, and organelle. But this, from the cell or tissue, this part belongs to the histology. You must watch it by the microscope because the naked eye can't see the structure of the fine structure, microstructure. Then, the first important is the anatomic position. You know, the anatomic position is used to describe our human body. This position, just like this, ask everybody to look forward, not like this, just look forward. Then our two upper limbs just beside our body. Another, our palms and our toes also toward. In this position, we call anatomical position. All of the describing according to this position. Such like, you know, head is in the upper, foot is in the lower. If we opposite, we also should say the head is in upper. So must be according to the anatomical position. Then a series of terms of direction. You know, a lot of organs, you must know the direction. So just some pairs of these terms. First is superior, inferior. Superior means above, just near the above. Inferior, near the lower, below. But sometimes, such like animals or fetus, because the fetus is not standing, there's no the position is commonly change every time. So we can also use the proximal and distal, or cranial caudal. Cranial means just near about the head, crane. Caudal means just near the coccyx. So just instead of the superior inferior in the fetus, we can use these two words. And proximal distal, commonly we use to describe the upper limb and lower limb. Such like the shoulder and the elbow. The shoulder is in the distal. The elbow in the distal in the distal. The shoulder is in proximal. Just like this. This is the first pair. The second pair is the anterior and posterior. Anterior means forward, or in front of our body, and the posterior just near to our back. So sometimes maybe instead of ventral or dorsal, ventral means towards the abdomen. The dorsal toward our back. Also, just the same anterior to posterior. The third part is median lateral. You know, this median lateral, according to our medial septal plane, everybody has a mid septal plane. This septal plane just divided into two halves. If nearer to this plane, then we call medial. If farther from this plane, we call lateral. The fourth is superficial and deep. Superficial and deep, just according to the skin. If near the skin, the outer, then we call superficial. If further from, then we call deep. Such like every bone is deep in our limbs or lower limb. Then another is internal and external. These two were just according to a cavity or a tube. If inner of the cavity, we call internal. If out of the cavity, we call external. Then the second important is the terms of axis. In our body, we can divide into three axes. One is set axis. The set axis means anterior, posterior, this direction. Just like this. Look, my head, just according to this action, just like axis left. Then the second is coronal or frontal. Then to left and right, this direction. Such like my shoulder joint. This. Then that is along the frontal action. Another is vertical action. The vertical action just vertical to the plane, vertical plane. So my head here, according to this action, to move our head. So these three actions. Here's the anterior, or we call sagittal axis. And here is the coronal axis. And here is the vertical axis. It's easy to remember. Then another, some planes, also divided into three. One is the sagittal plane, just along to the sagittal plane. Then this section we call sagittal plane. Such like here, so like here. This. Then the coronal plane or frontal plane, just along to the coronal axis. This section we call coronal plane. Here, this one, the left and right one. Then horizontal or transverse plane. Here, just like this, or we call cross section. In clinical, a lot of people to make the CT or MRI, just a series of cross section. This section we can also call horizontal section or transverse section.